Brittany Payne, and this is my disease project. For my disease project, I chose Leptosperra enterogens. So some topics that we will be covering are: what is Leptosperra? What is the structure of Leptospira? What is the pathophysiology of Leptospira? Who is most at risk for this disease? Treatments and methods for prevention. What is Leptospira? Leptospira is a bacterial disease caused by the genus Leptospira. This disease can be spread from rats and rodents' urine along with infected water. This bacteria is known to cause illness called leptospirosis. This disease can vary from a mild to a very life-threatening case. The structure of Leptospira. The bacteria is corkscrew-shaped with spiral or hooked ends that look like a question mark. It is an aerobic spirochete that continues to grow longer and multiply. The bacteria contains a layer of peptoglycan, and the outer layer is the outer sheath. The bacteria also has a cytoplasmic membrane. The bacteria is so thin that it cannot easily be seen with an ordinary microscope. The virulence of Leptospira. The virulence of Leptospira enterogens can be related to leptospiral LPS, which is noted to trigger macrophages in response to infection. Also, LPS is an overall virulence factor for gram-negative bacteria. Leptospira are able to store and associate fatty acids with their endotoxins GLP and LPS. CLPB holds the biggest role in bacterial virulence. It also helps by aiding the bacteria to survive inside its host and also helps to control the stress response. This disease can go through intact mucous membranes or lacerated or abraded skin, then enter into the bloodstream and multiply to react with all parts of the body. The toxicity of Leptospira. The toxicity of this disease can affect the eyes, the hosts, the organs, the skin, and the cerebral spinal fluid. Many cases of this disease are mild, but without treatment become fatal. The host may become jaundiced due to liver damage and can also experience renal failure from leptospires directly on the tubules. Lastly, meningeal irritation can be seen when leptospirals go into the host cerebral spinal fluid. How the disease interferes with normal pathophysiology. The disease leptospirosis has different phases of illnesses. First is the incubation period, which usually lasts about 7 to 12 days. Humans show signs of general malaise, muscle pain, nausea, and sudden onset of fever with congestion. During the second phase, the enteric phase, which can be up to 30 days, fever subsides and the antibodies emerge, and the uveitis, swelling of the eye, meningeal inflammation, renal tubular failure, and rash can develop. This is why it's so important to seek medical help right away. Which populations are most at risk for developing this disease? Leptospirosis is spread in the United States by dogs, rodents, cats, and most commonly rats. Humans are not the intended host for this disease, and human-to-human transmission is rare. The most likely people to contract this disease are those living in tropical or humid climate places. Occupations or activities that are most likely to contract this disease. Those who work around water, those who work in an agricultural field, and those who participate in recreational or outdoor sports. Some examples of these are sewer workers, dairy farmers, slaughterhouse workers, vegetarians, military personnel, and mine workers. The socioeconomic classes that are most at risk for developing this disease are the low income rural and urban areas, most commonly those with a lack of the ability to cope with floods, or those who cannot prevent rodent intrusion or infestation. The significance of leptospirosis on the community is the disease can affect water, soil, and animals, which can then affect drinking water, food, people in hurricanes, and people's homes. One treatment trend that is commonly used in the management of leptospirosis are antibiotics. Antibiotics care for leptospirosis is very important. It can decrease fatal outcomes, shorten the disease time, and one treatment plan for leptospirosis that includes pharmacological intervention is the use of oral antibiotic called amoxicillin, and you take this 3 times a day for 7 days to prevent furthering or spreading of the disease. The main antibiotics that are used for this are penicillins, like your ampicillin, amoxicillin, and doxycycline. Oral antibiotics must be given in the first 5 days of this disease, and the antibiotic regimen must be followed as the doctor provides. For more severe cases of leptospirosis, intravenous corticosteroid therapy is used for the more severe cases. 4 out of 5 clinical trial studies are shown to show improvement of intravenous corticosteroid therapy. They will reduce the spread of this disease and reduce pulmonary involvement, so your lungs. Okay, so steps to be undertaken for prevention of infection of the leptospirosis. You should avoid wading or swimming in any water that may be contaminated with mammal urine or infected animals. Try to control the amount of rodent contact and rodent population around and in your house, work, barn, or farm. Wear protective clothing when being exposed to contaminated water or soil due to a hobby or occupation. And here is just some examples. Here are my references. And thank you.